Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. As we just heard in that report there, numerous European countries are reporting hospitals at breaking point due to the massive resurgence of COVID-19 on the continent. Officials in those nations say the situation is so dire that they are reinforcing strict measures, including nationwide lockdowns and banning unvaccinated people from public places. Now, despite mass protests, Austria has gone into a nationwide lockdown, mandatory vaccinations as well to be enforced from February next year. The crisis, as we heard, is almost as acute in Germany. The country's health minister there warning that, quote, by the end of this winter, pretty much everyone in Germany will have been vaccinated, recovered or died.
And the World Health Organization has echoed that, saying several 100,000 people are projected to die from COVID-19 in Europe between now and spring next year. For more on this, we are joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Good morning.
Firstly, what are the variables causing this wave in Europe, and what do you make of the WHO's projection about the potential number of COVID-19 deaths there?
In Europe, they're still very vulnerable to COVID because they've done reasonably well in the last 2 years, the last 18 months. They haven't had so many infections in some parts of Europe particularly, and that means that they don't have that natural immunity, which is a good thing, but it means that right now they are vulnerable to having a lot of COVID spread. And not only Germany, Austria, Netherlands, but also, I would add, Greece and some countries in Eastern Europe. And so it's really a very worrying situation right now that they're vulnerable. And if all the public health measures are dropped and COVID's allowed to freely circulate, there could be a lot of infections this winter. So I hope that's not going to happen.
Now, I wanted to pinpoint Austria's highly controversial move. Many people in Austria have been taking to the streets quite angrily. They say this is a shocking overreach by their government. Where do you stand on their view that in some respects, for a lot of these countries, this is no longer really about public health, but rather controlling their populations?
Well, certainly in public health terms, we know that some restrictions have to stay in place. We can't drop everything, even with a relatively higher vaccine coverage. And in Austria, that it's not even that high. It's in the 60s to low 70s. And so restrictions do have to be put in place. I'm not sure that it's necessary to put them in place just for the unvaccinated, because I think there's many unvaccinated people who actually do have pretty reasonable immunity, because unfortunately they've been infected before, and this doesn't seem to take that into account. It seems to just class people as vaccinated or unvaccinated, whereas I would say it's more important if you're immune or not immune. And I think there's a lot of people who don't like this kind of policy. It feels like it's blaming the unvaccinated people, whereas there's more to the story than that. But at the same time, the government has to think of things to do to control transmission, because it can't be allowed to spread too easily. Otherwise, as you mentioned, there'll be a lot of hospitalizations this winter.
And Professor, we just mentioned that Germany's health minister said recently that, just to quote him again, by the end of this winter, pretty much everyone in Germany will have been vaccinated, recovered, or died. Should public officials choose their words more carefully, or is this kind of stark language warranted?
I think that's gone a bit beyond what we expect based on the data. What we know with infections like COVID is that over a period of time, particularly in a scenario where there's not much control measures, most of the population will have a chance to be infected. And that would be true in Korea, it would be true in Europe as well. So people in the community will have an exposure to the virus sooner or later. It may not be this winter, it may be in the coming years. Sooner or later, we will all have a chance to be infected. And at that point, it's much better for us if we've been vaccinated than if we haven't been vaccinated, because vaccine will reduce the chance we get infected. It will reduce the chance we get severe disease if we are infected. But at the same time, we may all eventually have a chance to get infected. And I suppose that's what he's trying to express. But it sounds very extreme, that the words that he chose.
Yeah, especially considering the fact that the recovery rate from COVID-19 is very high anyway, especially among younger, healthier people, those who are seriously ill with other conditions, of course, different story. But regardless, it seems that other countries in Europe are going to follow Austria's lead and perhaps that of Germany and the Netherlands and go into these full lockdowns to try and stem the spread. But what does the data show? Do these strict nationwide lockdowns, are they actually effective?
Well, certainly they've worked a number of times in the past 2 years, but the problem is that they're very, very disruptive to society. They're very disruptive to the economy. So we've been hoping they won't be needed anymore. And what I think we need to find is a middle ground. So in the past 2 years, many parts of the world have had to do these very stringent social distancing measures, very stringent lockdowns. Now with vaccines available, I think we're hoping that maybe we don't need anything. But actually, what will happen is something in between. We'll have the vaccines giving a lot of protection to the community, but we'll also need some form of social distancing, perhaps this winter, perhaps if the case numbers go up to a level that's threatening the public health system, the hospital system. But I hope that we won't see long-term widespread lockdowns because they're really damaging to society and to the economy. And we hope that we wouldn't need them anymore.
Yeah, we certainly hope so too. Now, Professor Cowling, as always, we're grateful for your insights and thank you so much for joining us again.
Thank you.